Hello there, I'm Lou Walker. I'm a registered health coach, which means I help people find ways to feel in control of their health and make the changes they need to live their lives to the full. So it's great that at the moment we're all focusing on health more than ever before. But I'm not sure we're going about this in the most useful way. For example, we're hearing a lot about how type 2 diabetes, heart disease and high blood pressure increase our risk from COVID. But we're not hearing about how obesity also increases our risk. And I think that seems unfair when we know that almost 2/3 of the UK's population is living with either overweight or obesity. All these conditions I've mentioned are metabolic conditions. Another important one is abdominal obesity, and that's where you carry excess weight around your torso and waist, and it can increase your health risk whether or not you're otherwise really quite slim. Metabolic conditions affect the whole body, and they share root causes related to diet and lifestyle. They're insidious, they're nasty, because other than the weight gain, there's often nothing to show you that there's anything going wrong. And although they're common, they're serious, and no one would choose to live with any of them. Sadly, our high streets, advertising and society in general don't make it easy for any of us to make healthy decisions. So it's no surprise really that so many people are living with metabolic conditions. So really, if we're going to protect the NHS and save lives, we need to be talking a lot more about metabolic health, both to cope with COVID and to improve the UK's health in general. There are so many things we can do. And when I say we, I mean you, me, our loved ones and colleagues. There are so many things we can do right now to improve our vitality, support our immune systems and make metabolic conditions far less likely. So I'm going to post some short videos over the next few weeks full of information, resources and practical ideas about how we can get better sleep, reduce our stress levels, move more and get more daylight. But where we're going to get the biggest benefits is from making changes to the way we eat. So that's where I'm going to start. It's a huge topic. It's an emotive topic, isn't it? But we really have to get to grips with quite how much what we eat affects our health and well-being. And just as important is to understand why. So I'm going to include enough science for you to make your own decisions about what makes sense to you. There's such a lot of noise, isn't there, about what we should be eating, and how to be healthy. But you know what? There is so much that everybody agrees on. We need to be cutting right down on sugar and processed foods, get plenty of veg, plenty of sleep, exercise and daylight. We need to sit less and reduce stress. So that's what I'm going to be focusing on, because they're also the things that improve metabolic health, put them into remission and can even prevent them from happening in the first place. I'm not a medical professional, so it's always a good idea to check with your GP before you make any big changes. But all the suggestions I'm going to make are evidence-based, realistic and can make a real difference in just a few short weeks. I'm afraid I'm not saying that they're all going to be easy, but some of them are, and many of them will seem obvious when you know about them. And they're all free. They cost nothing. It doesn't matter where you start, as long as you start somewhere with something that makes sense to you. Lifestyle expert Dr. Rangan Chatterjee puts it beautifully. He says, health isn't some distant goal. It's not something you become. It's something you do. And I so agree with that. And that's a message I really hope I can share. So perhaps I could be cheeky and suggest that the first thing you do is subscribe to my YouTube channel. There's a little button you can click just here, or the link is down below the video. If you subscribe, you'll get to find out as soon as each new video is posted. But I'd love it if you came along to join me to find out what you can do to feel in control of your health. I really look forward to seeing you.